Hello. In this video, we are going to be discussing how to identify the lobes of the brain. This video is for anyone interested in neuroscience or biopsychology. This will just be an introductory level slideshow. And my name is Isaiah Healy, and let's begin. There are 4 lobes of the brain. Firstly, we are going to be discussing this blue region here in this image or illustration. This is the frontal lobe, which is responsible for personality characteristics, decision-making and movement, sense of smell, and speech ability. Now, sense of smell, for example, the olfactory bulb in our brain plays the role for sense of smell. So that structure of the brain, the olfactory bulb, is in our frontal lobe. Now, next we will be discussing this green region here in this picture, which is the temporal lobe, which is responsible for short-term memory, speech production, musical rhythm recognition, and some smell recognition, but not as much as the frontal lobe, because that is where the olfactory bulb is, for example. Now, in the back here, in the posterior area of the brain, is the occipital lobe, which is primarily responsible for vision or sight for our eyes. And lastly, the 4th region here is the parietal lobe, which is responsible for spatial reasoning and identifying objects, which spatial reasoning is, for example, let's say if you're sitting in your living room and you look around, you can recognize that you're in the living room. You notice the TV, you notice the table, you can identify these objects. And next, it is also responsible for pain and touch interpretation, such as like feeling pain, feeling touch, and understanding spoken language. We are going to be discussing case studies just to understand the brain. So here we have case study number 1. So we have a 39-year-old female presenting with blurred vision in her right eye. So basically this patient had a benign tumor which was pressing up against her occipital lobe region, and that was causing vision disturbances. So here in this MRI, which is a form of medical imaging, you can see this white region right here that I'm pointing to. That is the benign tumor. Now, benign means that the tumor itself is not cancerous. If the tumor was not benign or more threatening, it would be called malignant. So this tumor, although it was threatening her vision, it was not cancerous. So to conclude, this tumor that was pressing up on her occipital lobe was disturbing her vision. Next, we have case study number 2. Here we have a patient who is diagnosed with attention deficit hyperactivity disorder, or also known as ADHD. This patient received a high-resolution MRI scan of their brain, which I provided here on the left. So the scan revealed frontal lobe size reduction and temporal lobe size reduction of their brain. Now, in my previous slides, I had mentioned how the frontal and temporal lobes of the brain are responsible for decision-making, short-term memory, and speech production. This case study here provides an example of the responsibility of these lobes. Now, a patient who has ADHD may make impulsive decisions or have issues with their short-term memory or memory in general, or even in children, children might have issues with learning speech or speech production. So case studies here provide us necessary evidence of our brain regions. Thank you for listening. Here in this final slide, I provided the citations that I used for this slideshow. Yeah, I hope you enjoyed it. This was a basic introductory level neuroscience and biopsychology. And thank you.